Welcome to today's video about ovarian cancer signs. Women often confuse with period pain. What if the period pain you've been dismissing could be something far more serious? Every month, millions of women experience pelvic discomfort, bloating, and fatigue. They brush it off as normal. But what they don't realize is that 13 specific warning signs could be masking a silent killer. Today, we're uncovering the hidden symptoms of ovarian cancer that women consistently mistake for ordinary menstrual pain. By the end of this video, you'll know exactly what to watch for and when to seek help. Your life could depend on it. Ovarian cancer is often called the silent killer because its symptoms are so easily confused with common menstrual issues. According to the American Cancer Society, only about 20% of ovarian cancers are found at an early stage when treatment is most effective. Yet, thousands of women delay seeking medical attention because they assume their symptoms are just normal period problems. Before we dive into these life-saving symptoms, if you're new here, welcome to Ageless Her, our community dedicated to empowering women's health at every stage of life. Make sure to hit that subscribe button and ring the notification bell so you never miss content that could literally save your life. Drop a comment below telling us where you're watching from. We love connecting with viewers from around the world who are taking charge of their health. The truth is more alarming than you might think. Here's what makes this particularly dangerous. Ovarian cancer symptoms often develop gradually. They mirror the discomfort you felt every month for years, but there are subtle differences that could save your life. Let's examine each warning sign and understand when period pain crosses the line into something potentially deadly. All right, here's the breakdown of ovarian cancer signs that many women mistake for period pain. Let's begin with number 1. Sign 1. Persistent pelvic or lower abdominal pain. Period cramps are completely normal. Every woman knows that familiar ache, but here's where it gets concerning. With ovarian cancer, the pain doesn't follow your cycle's predictable pattern. According to Mayo Clinic research, ovarian cancer can cause persistent pelvic pain that feels similar to menstrual cramping. The critical difference lies in timing and persistence. Normal period cramps resolve within days of your cycle ending. Cancer-related pain behaves differently. Medical news. Today reports that this pain may feel crampy just like menstruation, but it doesn't disappear when your period ends. The pain often becomes more constant rather than cyclical. Moffitt Cancer Center studies show that women with ovarian cancer frequently experience abdominal discomfort that feels like gas, indigestion, or pressure. This pain may be accompanied by swelling or bloating in the abdominal area. The key warning sign is pain that continues beyond 2 weeks or occurs frequently throughout the month. If your usual pain relief methods stop working, that's another red flag. Trust your body when something feels different from your normal pattern. Sign 2. Bloating or feeling of fullness. You wake up feeling like you gained 10 pounds overnight. Your jeans don't fit. You assume it's water retention from your period. This assumption could be dangerous. Mayo Clinic research shows that bloating is one of the most common symptoms of ovarian cancer. Dr. Jamie Barakman Gomez, a gynecologic oncologist at Mayo Clinic, explains that bloating from ovarian cancer occurs because tumors can cause fluid buildup in the abdomen called ascites. Normal period bloating follows a predictable pattern. It appears before your period and disappears afterward. Cancer-related bloating behaves completely differently. It persists regardless of your menstrual cycle. Moffitt Cancer Center studies indicate that this bloating often feels like constant fullness or pressure. Women describe feeling like they can't get comfortable. The swelling doesn't respond to typical remedies like reducing salt intake or taking diuretics. According to Medical News Today, persistent abdominal distension lasting more than 2 weeks requires medical evaluation. The bloating may be painful or accompanied by an uncomfortable sensation of tightness in the stomach area. Sign 3. Feeling full quickly when eating. You sit down for your favorite meal. After just a few bites, you feel uncomfortably full. You blame it on stress or hormone changes. But this symptom has a more sinister explanation. Early satiety is a medical term for feeling full after eating very little food. Mayo Clinic research explains that when there's a large mass in the pelvis, it can press against the stomach, making you feel full faster than normal. The difference from normal appetite changes is striking. Hormonal fluctuations during periods might affect your cravings or hunger levels, but you can still eat normal portions when you choose to. Cancer-related early satiety is involuntary and persistent. Moffitt Cancer Center studies show that women with ovarian cancer consistently report this symptom. Dr. Barakman Gomez notes that patients often say they feel hungry, but become full after eating only a small amount of food. Pay attention if you consistently feel full after eating much less than usual. This symptom often appears alongside the bloating we discussed earlier. Together, they create a pattern that demands medical attention. Sign 4. Changes in bowel habits. Your digestive system suddenly becomes unpredictable. Constipation alternates with diarrhea. You blame hormonal fluctuations around your period. This explanation might be hiding a deadly truth. Medical news. Today, research reveals that ovarian cancer can significantly impact bowel function. According to Moffitt Cancer Center, when ovarian cancer spreads, it travels on the surface of the lining that covers the intestines, which can affect how your bowels work. Normal period-related digestive changes follow your cycle. You might experience constipation for a few days before your period. It typically resolves once menstruation begins or ends. Cancer-related bowel changes are random and persistent. They don't correlate with menstrual timing. The changes continue regardless of where you are in your cycle. Mayo Clinic lists changes in bowel habits such as constipation as one of the key symptoms of ovarian cancer. Warning signs include sudden onset of chronic constipation or changes that persist for more than 2 weeks. Don't dismiss ongoing bowel irregularities as normal aging or stress. Sign 5. Frequent urination or urgency. You find yourself running to the bathroom constantly. The urgency feels overwhelming. You assume it's related to period bloating or drinking more water. The reality could be life-threatening. According to Mayo Clinic, ovarian cancer can cause a frequent need to urinate. Dr. Barakman Gomez explains that if there's a large mass taking up space in the pelvis, the bladder can't fill up all the way and hold as much urine as it normally would. Medical news. Today, research shows this pressure creates persistent urinary symptoms. The bladder cannot hold normal amounts of urine when compressed by tumors or fluid buildup. Moffitt Cancer Center studies reveal that cancer-related urinary symptoms differ from period changes. Menstrual bloating might cause mild urinary frequency for a few days. Cancer symptoms persist throughout the month. The urgency with ovarian cancer is often more intense. Women describe feeling like they must rush to the bathroom immediately. Dr. Barakman Gomez notes that patients often need to get up to urinate once, twice, or even 3 to 4 times at night. Sign 6. Low back pain. That nagging backache won't go away. You blame poor posture or sleeping wrong. You assume it's related to period cramps radiating backward. This assumption could delay crucial treatment. Mayo Clinic research shows that back pain can be a symptom of ovarian cancer. The pain may occur as cancer spreads or as masses grow large enough to press on surrounding structures. Medical news. Today, studies distinguish this from typical period-related back pain. Menstrual back pain usually coincides with cramping and resolves when periods end. It responds to typical pain relief measures. Cancer-related back pain is more persistent and unpredictable. It may not respond to usual treatments like heat, stretching, or over-the-counter pain medications. The pain often feels deeper and more constant. According to Moffitt Cancer Center, back pain associated with ovarian cancer may indicate that the disease has spread beyond the ovaries. This makes it particularly important not to dismiss persistent back pain. Sign 7. Menstrual changes. Your periods suddenly become heavier, more painful, or irregular. You assume it's natural aging or hormone fluctuations, but these changes could signal cancer developing in your reproductive organs. Moffitt Cancer Center research shows that ovarian cancer can affect menstrual patterns. If there's a tumor in your ovary, it can disrupt your normal cycle. Changes might include more or less frequent periods or no periods at all. Medical news. Today's studies reveal several concerning menstrual changes. Periods becoming significantly heavier than your baseline is one warning sign. The key is recognizing changes from your personal normal pattern. Every woman's cycle is different. What matters is when your established pattern shifts dramatically without explanation. Sign 8. Abnormal vaginal bleeding or spotting. Bleeding appears between your periods, blood after intercourse, spotting after menopause. You rationalize it as hormone changes or minor irritation. This bleeding could be a critical warning sign. Medical news. Today, research emphasizes that abnormal bleeding requires immediate evaluation. According to Moffitt Cancer Center, any bleeding that doesn't fit your normal pattern should be investigated, especially if it's new or persistent. Mayo Clinic studies show that postmenopausal bleeding is particularly concerning. After menopause, any vaginal bleeding is abnormal and needs investigation. Never dismiss abnormal bleeding as probably nothing. Healthcare providers need to evaluate any bleeding that doesn't fit your normal pattern. Sign 9. Unexplained weight loss or gain. The scale shows dramatic changes you can't explain. Rapid weight loss without dieting, sudden weight gain around your midsection. You blame metabolism changes or period-related water retention. The truth might be far more serious. Mayo Clinic research shows that unexplained weight loss can be a symptom of ovarian cancer. Advanced cancer often causes weight loss as the body burns more energy fighting the disease. Moffitt Cancer Center studies reveal that weight gain, particularly around the abdomen, can also occur. According to Medical News Today, cancer-related weight changes don't respond to normal interventions. Changes of more than 10 pounds over several weeks need investigation. Sign 10. Fatigue or low energy. You feel exhausted all the time. Simple activities drain your energy. You blame heavy periods, stress, or busy schedules. But this fatigue could indicate your body is fighting a hidden battle. Mayo Clinic research shows that fatigue is a common symptom of ovarian cancer. This fatigue differs significantly from normal tiredness. Period-related fatigue usually correlates with heavy bleeding or poor sleep during menstruation. Cancer fatigue is persistent and disproportionate to activity levels. Sign 11. Indigestion, gas, or gastrointestinal discomfort. Your stomach constantly feels unsettled. Gas, belching, and indigestion become daily problems. You blame menstrual hormones or dietary changes. These symptoms could be masking ovarian cancer. MD Anderson Cancer Center research shows that general abdominal discomfort, including gas and indigestion, can be symptoms of ovarian cancer. These symptoms often overlap with less serious conditions, making them easy to dismiss. Sign 12. Painful intercourse. Intimacy becomes uncomfortable or painful. You assume it's related to period changes, stress, or hormonal fluctuations. But new onset of sexual pain could indicate reproductive organ problems. Moffitt Cancer Center research shows that painful intercourse can be a symptom of ovarian cancer. When tumors grow in the pelvis, they can cause pain during sexual activity. Sign 13. Persistent symptoms that differ from your normal. This final sign encompasses everything we've discussed. Your body feels different. Symptoms persist beyond your normal menstrual pattern. Things that used to resolve don't improve anymore. Medical news. Today, research emphasizes that women often notice something feels off before specific symptoms become obvious. According to the American Cancer Society, symptoms lasting more than 2 weeks need evaluation. Dr. Barakman Gomez emphasizes that knowing your body and being your own advocate is still the best way to detect ovarian cancer. The key is knowing your own body. You understand your normal menstrual pattern better than anyone. Early detection of ovarian cancer dramatically improves treatment outcomes and survival rates, according to Medical News. Today, if ovarian cancer is diagnosed in the early stages, the 5-year survival rate is around 93%. However, if the cancer has spread to other parts of the body, the 5-year survival rate drops to 31%. The symptoms we've discussed today are your body's early warning system. Don't ignore them. If you're experiencing multiple symptoms from this list, especially if they're new or different from your normal pattern, schedule an appointment with your healthcare provider immediately. Remember, most of these symptoms have benign explanations, but ruling out cancer early provides peace of mind and potentially life-saving treatment options. The Mayo Clinic emphasizes that it's always better to be safe than sorry when it comes to persistent symptoms. If this video was helpful in understanding these important warning signs, kindly type helpful in the comments. Please like this video if it provided valuable information. Share it with the women in your life who need to see this and subscribe to Ageless Her for more health awareness content. Thank you for watching and taking charge of your health. Your life is precious and early detection saves lives.